Hello, viewers. My name is Dr. Pankaj Jariwala, and I am interventional cardiologist from Yashoda Hospital, Somajiguda. And today I am going to talk about heart attack and what are the medicines and what are the lifestyle you should follow after heart attack in a brief, in the language which all of you can understand. It is a normal to feel overwhelmed or confused after a heart attack. And this is my own experience, and it's a big problem. A heart attack represents a life-changing event after all. However, today, most people go back to living a long, healthy life after recovering from their heart attacks. With just a few precautions, some medications, lifestyle changes, and support from your loved ones, you should be able to recover and avoid future cardiovascular complications altogether. Adherence to all medications is very, very important, and strictly to all the drugs or medications which has been prescribed by physician or your cardiologist is very, very essential to take them, and is one of the most important thing you can do to help your own and your own heart. These are the medications that can greatly lower the risk of subsequent heart attack. That's why it is very, very important that we should continue them without a fail. Among these, antiplatelets, means what we call them commonly as blood thinners, are very, very critical in preventing subsequent narrowing of the blood vessels of the heart or blocking of your stent if has been deployed, if in any case. Stopping of any of these blood thinners without consulting your cardiologist can be extremely detrimental and dangerous. So patient can have a heart attack again, and that's why unless your doctor advises, never to stop any of these medications without any information. These are certain other risk factors that you may need to observe and also keep a control on them. In case you are a diabetic, it is mandatory that you should take the diabetic medications properly, regularly. Also, if there is a medications prescribed by a doctor for the lowering of the cholesterol, that also needs to be taken, and the blood pressure lowering drugs also has to be taken on regular basis. That will help in lowering the risk of various cardiac events coming in case to the patient. In case of any query or confusion regarding medications, their dosages, or necessity, please you have to reach out to the doctors for clarifications. And these days, as a cardiologist, we are giving our own contact numbers or our secretary's number, where you can reach out 24/7 without any hesitancy. Stopping your treatment means losing control over your own disease and depriving yourself of becoming healthy. Discontinuing any medication, even short breaks before its prescribed duration without consulting your doctor, can be very, very dangerous. Stopping of smoking is very, very important. I know it's very difficult to stop smoking, but you have to make efforts. Friends and social circle can help them out. And there are many de-addiction programs are available. Take help of them and try to cut down your smoking, because smoking leads to very high incidence of recurrence of cardiovascular complications. And if you are a smoker, it had be how to good help and quit smoking immediately. Is very, very important. Side effects and what to do. So many of the time patients think that if they're taking too many medications and they may develop side effects, they will have effect on their kidneys. And many of the people think that fatigue, breathlessness, heartburn, headache, nausea, stomach upset, diarrhea, nose bleeding, all these things, if they are there, you need to address them in consultation with your doctor. And if you experience them, immediately come to the hospital if doctors are not reachable, and try to solve the problem, whatever you have. Do not, however, stop any medications on your own if you are developing any specific symptoms. without any instructions from your cardiologist asking you to discontinue. Eating is very, very important, what we call it as a diet, and it comes as a part of our cardiac rehabilitation program. And not only dietitians, but nutritionists, but also a cardiologist. We always encourage our people and we try to enlighten the concept of the diet so that people understand them very easily. And those who are having more weight, obesity, need to control their weight, and that will control their blood pressure also and cholesterol also. So healthy dietary pattern emphasizes a variety of fruits and vegetables, whole grains, low fat dairy products, skinless poultry and fish, nuts and legumes, and non-tropical vegetable oils. These are very, very important. And limit your consumption of high saturated fatty foods and processed and fried foods, sweets and desserts. So these are very, very important. You should adhere to your diet very strictly without fail. Exercise and cardiac rehabilitation, as I told you, is very important. A sedentary lifestyle should be avoided by all the cardiac patient unless advised specifically by your cardiologist. Making lifestyle changes like getting regular exercise is very, very important for your better health. You can start gradually, and what we call it as aerobic exercises or cardio exercises, which should come make you back to your normal life. Walking is highly recommended because it is safe, free, and easy. And you can speak with your doctor or your physical therapist to get suggestions specific to your need and case. Getting cardiac rehabilitation is highly advisable to improve your heart health. Follow-up, which is very, very important. And I find that many of the patients, they drop, they don't come to the doctors once they start feeling okay. And following mentioned precautions and guidance should put you in a good position to go back and lead your normal life without a worry. I have many patients, despite of suffering with the heart problems, including major heart attacks, they are doing a very good, productive life, back to normal, and they are able to do this because they are doing a good follow-up with doctor at regular interval, and they're very proactive approach managing your condition. And my all the old patients, they are like friends to me, and we always discuss WhatsApp, we chat, and whatever their problems are there, I try to solve them like a friend, not like a doctor. So I wish all those patients and patient family, those who are listening my talk, a very healthy life ahead. Thank you very much. If any questions are there, you can send me and I will be very much happy to reply them. Thank you very much.